So I'm Simone Stoute, and I'm based at the California Animal Health and Food Safety Turlock branch. So the Turlock and the Tulare branch, we're the ones that usually see most of the commercial poultry. Pretty soon, in about 4 years, Turlock is going to transition into a full service lab, but we'll still be providing service to the poultry industry in California. So what's the most common reason that we get for people submitting layers to the lab? Um, People usually complain of a drop in egg production, so decrease in egg production, and as well as increased morbidity and mortality issues. So we did a chart, and I kind of like looked at what type of diseases we've been seeing in the last 2 years. So from 2019 to 2021, what kind of diagnoses are we making at California Animal Health and Food Safety? So in the top left, you'll see like the most common thing that's diagnosed is E. coli, salpingitis, peritonitis, and all of these are kind of intertwined with each other, right? Many times when we see salpingitis and peritonitis, it's because we're getting an E. coli infection there. And these conditions are usually more prevalent as the birds age. So as you get closer to the end of the life of the flock, I tend to see more cases of peritonitis, reproductive tract infection, and E. coli is the most common bacteria that I'm isolated from these cases. And interestingly, when I looked at the period from 2017 to 2019, I did see an increase in E. coli and peritonitis cases. And so you can probably like maybe assume that moving the birds to the floor where they have increased contact with their fecal material is increasing E. coli infections. Another, in red is the ones that I circled that I'm going to touch on today. I only have 15 minutes, so I'm not going to like discuss the list of all of the conditions that we see in this list, but I will touch on infectious coryza, fowl cholera, cannibalism, and coccidiosis and necrotic enteritis, and those two kind of go hand in hand. So the first one is cannibalism and vent pecking. The reason why I chose this one is because I noticed that we've been seeing a significant increase in cases of cannibalism in layers in the last 2 years compared to the period from 2017 to 2019. And I guess this makes sense because now you have birds that they're out of cages, so you're going to see more of their natural behavior coming through. So it's probably that this condition, cannibalism, is more widespread in cage-free systems. And we have to remember that pecking is a multifactorial condition. So it's affected by multiple things such as genetics, the environment, and nutrition. So recent research has suggested that a small portion of birds which initiate feather pecking will initiate feather pecking, and then that behavior tends to spread throughout the flock. I didn't go into mechanisms of control of vent pecking. I know people kind of like recommend that you need to go in and make sure that the birds are not exposed to external stress, or the lighting is not off. Sometimes with excessive lighting, you can induce feather pecking. But you really need to make sure that that's the actual problem before you actually go in there and start manipulating your lights and all of that. So you really need to have like your veterinarian walk through the house and see if you can figure out any underlying factors that could be triggering cannibalism. And then I moved to infectious coryza. So I thank Rodrigo for all his information on infectious coryza. So I pulled the numbers of infectious coryza that we've been getting in the lab. And I look at the period 2017 to 2019, we had about 37 cases in layers during that period. Compared to the last 2 years, from 2019 to up until I pulled the data from September 2021, and we could see a significant increase in the number of cases of infectious coryza that I'm getting in layers. And this is actually pretty interesting because layers are vaccinated for infectious coryza. So why are we seeing this increase? Yes, this is correlating with us transitioning into cage-free systems in California, but that does not necessarily prove causation that taking birds out of cages is increasing infectious coryza in layers. This increase can be due to multiple factors. I'm thinking coryza is one of those organisms that if you don't specifically look for it in the lab, you won't find it. So this requires special media to grow. So if your diagnostician doesn't actually try to look for coryza, we won't detect it. So I think like we're becoming more aware of coryza in the United States because we've been seeing a dramatic increase in cases. So the lab is being a lot more vigilant at looking for it. So we're picking up a lot of coryza infections. And interestingly, when I pull the history on these flocks, most of them are vaccinated. They've received at least one vaccine. So we need to really go in and see what's happening with the vaccination program. Maybe it needs tweaking. And as Rodrigo mentioned, you may need to make sure that application of the vaccine is being done correctly, because vaccination doesn't necessarily equate with immunization. So you have to make sure that the technique is correct, and also the timing of your vaccination is appropriate so that the birds aren't actually becoming infected before they've been vaccinated. So a little bit about infectious coryza. I can go through this quickly because Rodrigo covered a lot of it. It's a bacterial infection. So in the reports, you'll see me report positive for Avibacterium paragallinarum. So that's a bacteria that causes infectious coryza. And in layers, we will see respiratory signs. So a lot of times you'll see swelling around the eyes, nasal discharge, mucus coming out of the nares. It can cause increased mortality, decreased egg production, morbidity. And the mortality, you can see it varies widely from 5 to about 35%. That higher mortality, where it's closer to 35%, that's what I usually see in immune flocks, like in broilers, where these birds have never been vaccinated, never been exposed to coryza. When they first become exposed, you see dramatic increases in mortality. But in layers where these birds at least have some partial protection, the mortality is usually not that high. So a couple of tips on prevention. I would admit it's a lot more difficult to eliminate infectious coryza in layers compared to broilers, simply because we don't use mechanisms like an all-in, all-out system. And then the carrier state for infectious coryza is very important. So we have this particular bacteria has the ability to infect a bird without causing clinical signs. So the birds are actually looking very healthy, but they are still infected with infectious coryza and shedding that bacteria into the environment. And I feel like that is a very important source of having infectious coryza being transmitted from infected to susceptible flocks. So we really have to look at the subclinical carrier state. And in California, we use autogenous bacterins, and we also use a trivalent vaccine. So trivalent just means that we have 3 serotypes of infectious coryza, serotype A, B, and C, and the vaccines that we're using has all 3 serotypes are included. So that should give you cross protection. That should give you protection against all 3 serotypes. So technically, they should work. Rodrigo, from his presentation, you can see it's a little bit more complicated. And we need to look at other factors besides just vaccine administration for controlling coryza. Okay, then I wanted to touch on fowl cholera, because that was another condition that I noticed I'm seeing a dramatic increase in detection of fowl cholera. So from 2017 to 2019, I only detected 16 cases, but in the last 2 years, we've had 60 cases throughout our diagnostic system of fowl cholera being diagnosed. So that's a very significant increase. I'm not sure what are all of the underlying factors that are causing us to see more fowl cholera happening. So with fowl cholera, one of the complicated things of controlling this bacteria, it's caused by a bacteria known as Pasteurella maltosida. So what complicates control of fowl cholera in layers? Well, for one, we have at least 16 serotypes of fowl cholera has been described. And this really complicates control of this bacteria, because you have to make sure that when you're vaccinating, that the vaccine that you're using is matching the serotype that's on your farm. So what I do whenever I have a positive fowl cholera case is I send it for serotyping and fingerprinting to kind of like evaluate what sort of serotypes I'm getting in the field. The good thing, it is easily destroyed by many disinfectants. Another thing about fowl cholera that kind of complicates control is that recovered birds can remain as carriers and shed the bacteria. And another problem with fowl cholera is that it's not just a bacteria that's restricted only to avian species. You can have infection of fowl cholera in wild birds, mammals, such as rodents, cats, many different animal species can harbor fowl cholera and introduce it into your poultry house. So that's something we really need to look at. So most of this we said already. So I kind of showed you two pictures. Fowl cholera can manifest itself in so many ways. I just chose two pictures, but really you can get like a acute septicemic form, and you can also get that chronic form where you can get that fowl cholera being localized in different areas. So sometimes it's the comb and the wattles. Other times you may see it on the tendons, joints, foot pads. So this particular bacteria has the ability to just become localized and just remain there for a very long time in the bird. So I spoke about most of this already. So for prevention, we really want to prevent wild birds from getting in contact with the flocks. And we do have vaccines available for fowl cholera. I spoke to Dr. Cutler recently, and he was telling me about an SRP vaccine. It's a siderophore receptor protein vaccine. We're really excited about it to see how well it works against fowl cholera. So I can move on to the next one. This is an interesting one because coccidiosis and necrotic enteritis is something that we rarely used to see in layers. And that's because in the past, we used to have most of our layers in cages. But now that we take them out of the cages and put them on the ground, we've seen an increase in the coccidia and necrotic enteritis cases. And that's because coccidia, in order for the birds to acquire Coccidiosis, they really get it from litter and from fecal contamination of the litter, and they ingest the Coccidiosis from that litter. So when you take the birds out of the cages and they now have contact with fecal material, we tend to see an increase in coccidia occurring. And I combine these two conditions, coccidia and necrotic enteritis, because oftentimes necrotic enteritis tends to follow a coccidia infection. So coccidia, they tend to be co-specific, and they're caused by different species of a parasite known as Eimeria. We have several species of Eimeria that can affect chickens. And how do the birds get, the house becomes contaminated with coccidia? So it can be carried into the house by people, dust, equipment. And we have to remember that moist conditions are ideal for coccidiosis to proliferate and sporulate. So we really want to pay attention to litter management, make sure that litter is dry, as moist conditions can enhance coccidia proliferation. So what do we see when birds have coccidia? This picture that I'm showing here is like a classic example of what birds look like. They look depressed, the head is down, the feathers are ruffled. Oftentimes the birds look a little bit runted. You might have mucoid diarrhea. So that really represents what sick coccidia birds kind of look like to me. I mean, it's not specific. Other diseases can lead to depression and ruffled feathers. So for us to diagnose this, it's pretty easy for us to detect this in the lab. We do a necropsy, open the intestines, and you'll see classic intestinal lesions with coccidia. The severity of the lesions, of course, will vary with how severe the infection is. Necrotic enteritis, this frequently follows a coccidia infection, and it's caused by a bacteria, Clostridium perfringens, and the toxins produced by this bacteria. So the first couple of pictures I put, these two show you severe cases of coccidia. The one on the left looks like an Eimeria necatrix, and the other one is like a classic case of necrotic enteritis. But a lot of times in the lab, we get excited about taking the most severe, taking pictures of the most severe lesions that we have. But I would say that 90% of the coccidia cases don't look this impressive. Most of the time, they look just like these pictures here I have on the right. The intestines look a little bit thin. You have watery content, some undigested feed. So this to me represents what most of my cases are looking like when they come in the lab. And when I do a scraping, I can get large numbers of coccidia, and the intestines look like what I'm seeing here on the left. So it really depends on the stage of the infection, the species of coccidia. So, I mean, the presentation of lesions is very variable. So for control and management, as we said, we really need to pay attention to the litter and manage humidity and moisture levels in that litter. And we do have coccidia vaccines that are available, as well as anti-coccidial compounds. For supportive therapy, we do recommend administration of vitamins in the water. And necrotic enteritis, treatment is a bacteria, so antibiotics in drinking water. Remove sick birds promptly because you don't want to have that cannibalism from the sick birds can menace you. So that was the last one. And I just wanted to, I actually took a drive down to the site. This is where the new Turlock lab is going to be built. The timeline is approximately the next 4 years. So let me see if it will play. So this is where the new lab will be. This is on Diane Drive in Turlock. It's pretty close to the Dust Bowl. So we're pretty excited about having that new lab come on board in Turlock. And with that, I'll take any questions from you guys.